Hello, and welcome to CMS's webinar on the No Surprises Act's Good Faith Estimate and Patient-Provider Dispute Resolution Requirements. My name is Jean Ann Scabera, and I will provide some background information before turning it over to my colleague to go into details on the provider requirements. Here's our agenda for today's presentation. We will provide some background information, including an overview of the No Surprises Act protections for uninsured or self-pay individuals. We will discuss the good faith estimate requirements, and we will describe the patient-provider dispute resolution process. Please note that the information provided in this presentation is intended only to be a general informal summary of technical legal standards. It is not intended to take the place of the statutes, regulations, or formal policy guidance upon which it is based. This presentation summarizes current policy and operations as of the date it was presented. We encourage readers to refer to the applicable statutes, regulations, and other interpretive materials for complete and current information. The contents of this document do not have the force and effect of law and are not meant to bind the public in any way unless specifically incorporated into a contract. This document is intended only to provide clarity to the public regarding existing requirements under the law. This communication was printed, published, or produced and disseminated at U.S. taxpayer expense. And now we will begin our webinar. Let's begin with an overview of the No Surprises Act. The No Surprises Act introduced new requirements for providers, facilities, and providers of air ambulance services to protect individuals from surprise medical bills. These requirements prohibit providers and facilities from directly billing individuals for the difference between the amount they charged and the amount that the individual's plan or coverage will pay, plus the individual's cost-sharing amounts, i.e. balance billing, in certain circumstances. Require providers and facilities to provide good faith estimates of charges for care to uninsured or self-pay individuals upon scheduling care or on request, and for individuals with certain types of coverage to submit good faith estimates to the individual's plan or issuer. Create a patient-provider dispute resolution process for uninsured or self-pay individuals to contest charges that are substantially in excess of the good faith estimate. Require certain providers and facilities to publicly disclose restrictions on balance billing, and limit billed amounts in situations where a provider's network status changes mid-treatment or individuals act on inaccurate provider directory information. The scope of individuals protected under the No Surprises Act. Beginning January 1, 2022, these No Surprises Act requirements will apply to items and services provided to most individuals enrolled in private or commercial health coverage, such as employment-based group health plans, both self-insured and fully insured, individual or group health coverage on or outside the federal or state-based exchanges, federal employee health benefit or FEHB health plans, non-federal governmental plans sponsored by state and local government employers, certain church plans with IRS jurisdiction, and student health insurance coverage as defined at 45 CFR 147.145. Some requirements also apply to providers and facilities with respect to uninsured or self-pay individuals, like requirements that providers and facilities provide good faith estimates for scheduled care or upon request. Requirements under the No Surprises Act don't apply to beneficiaries or enrollees in Medicare, Medicaid, Indian Health Services, Veterans Affairs Healthcare, or TRICARE. These programs have other protections against high medical bills. The protections also don't apply to short-term limited duration insurance, accepted benefits, or retiree-only plans, or account-based group health plans. This is one of a series of presentations on the No Surprises Act. Other slide decks in this series can be found on the No Surprises website, cms.gov/no surprises. Overview of the No Surprises Act's protections for uninsured or self-pay individuals. Effective January 1, 2022, the No Surprises Act protects uninsured or self-pay individuals from many unexpectedly high medical bills. If an individual does not have certain types of health insurance or does not plan to use that insurance to pay for healthcare items or services, they are eligible to receive a good faith estimate of what they may be charged before they receive the item or service. A new patient-provider dispute resolution process is available for uninsured or self-pay individuals who get a bill from a provider that is substantially in excess of the expected charges on the good faith estimate. Under the PPDR process, an uninsured or self-pay individual or their authorized representative may initiate the PPDR process to seek a determination from an independent third party certified by HHS, a selected dispute resolution or SDR entity, for the amount the individual has to pay. This process can provide the uninsured or self-pay individual important consumer protections from paying billed charges that are significantly more than the expected charges in the good faith estimate. And now I will hand it over to my colleague, Jamie Hermanson, who will present information on the good faith estimate requirements.
My name is Jamie Hermanson, and I'm providing an overview of the No Surprises Act protections for uninsured or self-pay individuals. On October 7th, 2021, HHS published interim final rules titled Requirements Related to Surprise Billing Part 2, implemented various provisions of the No Surprises Act, including good faith estimates and the PPDR process for payment determinations. This presentation will focus on what information must be included in the GFE and the PPDR process. Good faith estimates for uninsured or self-pay individuals. The good faith estimate, also referred to as a GFE, is a notification that outlines an uninsured or self-pay individual's expected charges for a scheduled or requested item or service. Providers and facilities must give this estimate to an uninsured or self-pay individual or their authorized representative who requests it or who schedules an item or service. The good faith estimate will also include items or services reasonably expected to be provided, along with the primary items or services, even if the individual will receive the items or services from another provider or another facility. These requirements are applicable for good faith estimates requested on or after January 1, 2022, or for good faith estimates required to be provided in connection with items or services scheduled on or after January 1st, 2022. Scope of providers that must comply with the No Surprises Act requirements pertaining to protections for uninsured or self-pay individuals. For the purposes of the good faith estimate, a healthcare provider means a physician or other healthcare provider who is acting within the scope of practice of that provider's license or certification under applicable state law, including a provider of air ambulance service. The following types of healthcare providers must comply with the NSA's good faith estimate and PPDR requirements: physicians, other healthcare providers who are acting within their scope of practice under applicable state law, and providers of air ambulance services. Scope of facilities that must comply with NSA requirements pertaining to protections for uninsured or self-pay individuals. All healthcare institutions licensed under applicable state or local law are treated as healthcare facilities that must comply with the No Surprises Act, GFE, and PPDR requirements, including, for example, hospitals, outpatient hospital departments, critical access hospitals, ambulatory surgical centers, rural health centers, federally qualified health centers, laboratory centers, and imaging centers. Scope of care included in good faith estimates. Under the NSA, uninsured or self-pay individuals should receive a single comprehensive GFE that includes expected charges for the primary item or service that will be furnished by the convening provider or convening facility, and that is the initial reason for the visit. All items and services that are reasonably expected to be provided in conjunction with the primary item or service provided during a defined period of care. These items or services can include any of the following: encounters, procedures, medical tests, supplies, prescription drugs, durable medical equipment, or fees, including facility fees. An example, we provide a good faith estimate for knee surgery. If an individual schedules a knee surgery with their orthopedic surgeon, a good faith estimate could include an itemized list of items or services in conjunction with and including the actual knee surgery, such as physician professional fees, assistant surgeon professional fees, anesthesiologist professional fees, facility fees, prescription drugs, and durable medical equipment fees. All of the items and services that are reasonably expected to be provided from admission through discharge are part of that scheduled knee surgery period of care. These services or items should be included in the good faith estimate. Separate good faith estimates would be provided upon scheduling or upon request for any items or services that are necessary prior to or following provision of the primary item or service beyond the period of care, such as preoperative laboratory tests or post-discharge physical therapy. How unexpected charges are determined for a good faith estimate. Expected charges included on a good faith estimate should be the cash pay rate or rate that the uninsured or self-pay individual would be expected to pay for items or services listed on the good faith estimate. The expected charges should reflect true anticipated billed charges, including any anticipated discounts or adjustments that a provider or facility would anticipate applying to the uninsured or self-pay individual. For example, the expected charges provided by a federally tax-exempt nonprofit hospital should apply any adjustments billed charges that would be applied to an individual under the hospital's financial assistance policy. In determining expected charges, providers and facilities are expected to use the coding that best describes each item or service listed in the good faith estimate. When a single service code is available that captures reporting and billing for the component parts of an item or service, the single service code and expected charge for that single service code would be reported in the good faith estimate to capture the most comprehensive coding level. The component parts would not be included in the good faith estimate as they would not be separately reported or billed. Convening provider or facility and co-provider or facility. A convening provider or facility must provide a good faith estimate to the uninsured individual, including any item or service that is reasonably expected to be provided in conjunction with a scheduled or requested item or service by another provider or facility, also referred to as a co-provider or co-facility. As a result, the good faith estimate could contain expected charges from multiple providers, the convening provider, and co-providers or co-facilities that furnish items and services that are customarily provided in conjunction with a primary item or service. For instance, if a patient schedules a surgery, the convening provider or facility might include in the good faith estimate cost of the surgery, and the co-provider or co-facility might include the costs of any labs, tests, or anesthesia that may be used during the operation. We now move on to a knowledge check. A provider is deciding which CPT codes to use for a laboratory test. The provider is choosing between CPT code 85027 or individual CPT codes for each component parts of the service, represented by CPT code 85027. In order to remain compliant with the NSA, which option would best describe the item or service for use in the GFE? Knowledge check answer. HHS expects that the GFE would include expected charges for CPT code 85027, not expected charges for each component part, since there is a single CPT code available that better captures reporting for all of the component parts of the laboratory service. And a single service code is available that captures reporting and billing for the component parts of an item or service. The single service code and expected charge for that single service code would be reported in the GFE to capture the most comprehensive coding level. Informing uninsured or self-pay individuals. A convening provider or facility must inform all uninsured or self-paid individuals of the availability of a good faith estimate of expected charges upon scheduling an item or service or upon request. To determine if someone is an uninsured or self-pay individual, the provider or facility must ask if the individual is enrolled in a group health plan, group health insurance coverage offered by a health insurance issuer, a federal health care program, a health benefits plan under a federal employee's health benefits. If not enrolled in any of the above, the individual is considered uninsured for the purposes of the good faith estimate. If the individual is enrolled in a group health plan, group or individual health insurance coverage offered by a health insurance issuer, or an FEHB health benefits plan, the convening provider or facility must ask if the individual is seeking to have a claim submitted for the items or services with such plan or coverage. If not, the individual is considered self-pay for the purposes of the good faith. Distribution and display of the good faith estimate to individuals. Information regarding the availability of good faith estimates for uninsured or self-pay individuals must be written in a clear and understandable manner, prominently displayed and easily searchable from a public search engine on the convening providers or convening facilities website, in the office, and on site where scheduling or questions about the cost of items or services. Convening providers and facilities must also give information about the good faith estimate for uninsured or self-pay individuals when scheduling an item or service or when questions about the cost of items or services. Convening providers and convening facilities must consider any discussion or inquiry regarding the potential cost of items and services under consideration as a request for a good faith estimate. Timeframes. Upon receiving a request for a good faith estimate from an uninsured or self-pay individual, or upon scheduling a primary item or service for an uninsured or self-pay individual, the convening provider or convening facility must contact all co-providers and co-facilities who are reasonably expected to provide items or services in conjunction with and in support of the primary item or service no later than 1 business day after scheduling or receiving the request. The convening provider or convening facility must request that the co-providers or co-facilities submit good faith estimate information to the convening provider or facility. Convening providers and facilities must provide a good faith estimate to uninsured or self-pay individuals within the following timeframes. When a primary item or service is scheduled at least 3 business days before the date the item or service is scheduled to be furnished, the GFE must be provided no later than 1 business day after the date of scheduling. When a primary item or service is scheduled at least 10 business days before such item or service is finished, the GFE must be provided no later than 3 business days after the date of schedule. When a GFE is requested by an uninsured or self-pay individual, the GFE must be provided no later than 3 business days after the date of the request. HHS recognizes that some providers or facilities may need to establish efficient and secure communication channels for transmission of good faith estimate information between convening providers or facilities and co-providers and co-facilities. It is also understood that it may take time for providers and facilities to develop systems and processes for receiving and providing the required information from co-providers and co-facilities. Therefore, for good faith estimates provided to uninsured or self-paid individuals from January 1st, 2022 through December 31st, 2022, HHS will exercise its enforcement discretion in situations where a GFE provided to an uninsured or self-pay individual does not include expected charges from co-providers or co-facilities. A co-provider or co-facility is not prohibited from furnishing the information before December 31st, 2022, and nothing would prevent the uninsured or self-pay individual from separately requesting a good faith estimate directly from the co-provider or co-facility, in which case the co-provider and co-facility would be required to provide a good faith estimate for such items or services. Otherwise, during this period, HHS encourages convening providers and convening facilities to include a range of expected charges for items and services reasonably expected to be provided and billed by co-providers and co-facilities. Changes to the scope of the GFE. If a convening provider, convening facility, co-provider, or co-facility anticipates or is notified of any changes to the scope of a GFE, such as anticipated changes to the expected charges, items, services, frequency, recurrences, duration, providers, or facilities previously furnished at the time of scheduling, the convening provider or convening facility must provide the individual with a new GFE no later than 1 business day before the items or services are scheduled to be furnished. If any changes in expected providers or facilities represented in the GFE occur less than 1 business day before the item or service is scheduled to be furnished, the replacement provider or facility must accept the GFE for the relevant items or services being furnished that was provided by the replaced provider or facility. For good faith estimates provided upon request of an uninsured or self-pay individual, upon scheduling of the requested items or services, the convening provider or convening facility must provide the individual with a new GFE for the scheduled item or service within the standard timeframes specified in the timeframe section of this presentation. Good faith estimate for recurring primary items or services. A convening provider or convening facility may issue a single GFE for recurring primary items or services if both of the following requirements are met. The GFE for recurring items or services includes, in a clear and understandable manner, the expected scope of the recurring primary items or services, such as timeframes, frequency, and total number of recurring items and services. The scope of a good faith estimate for recurring primary items or services does not exceed 12 months. Requirements for co-providers and co-facilities. Co-providers and co-facilities must submit GFE information upon the request of the convening provider or convening facility. The co-provider or co-facility must provide, and the convening provider or convening facility must receive the GFE information no later than 1 business day after the co-provider or co-facility receives the request from the convening provider or convening facility. Co-providers and co-facilities must notify and provide new GFE information to a convening provider or convening facility if the co-provider or co-facility anticipates any changes to the scope of the GFE information previously submitted to the convening provider or facility, such as anticipated changes to the expected charges, items, services, frequency, recurrences, duration, providers, or facilities. If any changes to the co-providers or co-facilities listed in the good faith estimate occur less than 1 business day before the item or service is scheduled to be furnished, the replacement co-provider or co-facility must accept as its good faith estimate of expected charges the GFE for the relevant items or services included in the GFE provided by the replaced provider or facility. In the event that an uninsured or self-pay individual separately schedules or requests a GFE from a provider or facility that would otherwise be considered a co-provider or co-facility, that provider or facility must meet all requirements that apply to convening providers and convening facilities for issuing a GFE to the individual. Content requirements for a GFE issued to an uninsured or self-pay individual. A GFE issued must include the patient name, date of birth, description of the primary item or service in clear and understandable language, and if applicable, the date the primary item or service is scheduled, an itemized list of items and services grouped by each provider or facility reasonably expected to be furnished for the primary item or service, and items or services reasonably expected to be furnished in conjunction with the primary item or service for that period of care, including both items and services reasonably expected to be furnished by the convening provider or convening facility for the period of care, and items or services reasonably expected to be furnished by co-providers or co-facilities. The GFE also includes the applicable diagnosis codes, expected service codes, and expected charges associated with each listed item or service, along with the name, national provider identifier, and tax identification number of each provider or facility represented in the GFE, and the states and office or facility locations where the items or services are expected to be furnished by such provider or facility. The GFE also includes a list of items or services that the convening provider or convening facility anticipates will require separate scheduling and that are expected to occur before or following the expected period of care for the primary item or service. The GFE must include a disclaimer directly above this list that includes all of the following information. Separate good faith estimates will be issued to an uninsured or self-pay individual upon scheduling or upon request of the listed items or services. Notification that for items and services included in this list, information such as diagnosis codes, service codes, expected charges, and provider or facility identifiers do not need to be included, as that information will be provided in separate GFEs upon scheduling or upon request of such items or services, along with instructions for how an uninsured or self-pay individual can obtain GFEs for such items or services. GFEs also include a disclaimer that informs the uninsured or self-pay individual that there may be additional items or services that the convening provider or convening facility recommends as part of the course of care that must be scheduled or requested separately and are not reflected in the good faith estimate. An additional disclaimer that informs the individual that the information provided in the good faith estimate is only an estimate regarding items or services reasonably expected to be furnished at the time the GFE is issued to the uninsured or self-pay individual, and that actual items, services, or charges may differ from the GFE. A disclaimer that informs the uninsured or self-pay individual that the individual's right to initiate the patient-provider dispute resolution process, or PDR, if the actual billed charges are substantially in excess of the expected charges included in the good faith estimate. This disclaimer must include instructions for where the individual can find information about how to initiate the PPDR process, and state that the initiation of the PPDR process will not adversely affect the quality of healthcare services furnished to the individual by a provider or a facility. And then disclaimer that a good faith estimate is not a contract and does not require the uninsured or self-pay individual to obtain items or services from any of the providers or facilities identified in the GFE. HHS has developed a model, template, and notice that providers and facilities may use to prepare good faith estimates for uninsured or self-pay individuals, and to notify uninsured or self-pay individuals of the availability of a GFE. Use of this model notice is not required and is only provided as a means to facilitate compliance with applicable notice requirements. This model notice and template were published as part of CMS Form 10791 and are available for download. And here we show an image of the HHS model notice and template. Content requirements for GFE information submitted by co-providers or co-facilities to convening providers or convening facilities. GFE information submitted to convening providers or convening facilities by co-providers or co-facilities for inclusion in GFE must include patient name and date of birth, a list of items or services expected to be provided by the co-provider or co-facility that are reasonably expected to be furnished in conjunction with the primary item or service as part of the period of care, applicable diagnosis codes, expected service codes, and expected charges associated with each listed item or service, the name, national provider identifier, and tax identification numbers of the co-provider or co-facility, and the states and the office or facility locations where the items or services are expected to be furnished by the co-provider or co-facility. A disclaimer that the GFE is not a contract and does not require the uninsured or self-pay individual to obtain the items or services from any of the co-providers or co-facilities identified in the GFE. Required methods for providing GFEs for uninsured or self-pay individuals. A GFE must be provided in written form either on paper or electronically pursuant to the uninsured or self-pay individual's requested method of delivery and within the time frames described above. GFEs provided electronically must be provided in a manner that the uninsured or self-pay individual can both save and print. GFEs provided to uninsured or self-pay individuals by paper mail may be postmarked by the timelines specified in the time frame section of this presentation. GFE must be provided and written using clear and understandable language. Additional requirements. A good faith estimate issued to an uninsured or self-pay individual under this section is considered part of the patient's medical record and must be maintained in the same manner as the patient's medical record. Convening providers and convening facilities must provide a copy of any previously issued GFE furnished within the last 6 years to an uninsured or self-pay individual upon request by the individual. For all providers or facilities that issue GFEs following their state's processes and rules, if those state processes and rules do not meet federal good faith estimate requirements, those providers and facilities have failed to comply with federal good faith estimate. A provider or facility will not fail to comply with federal GFE requirements solely because, despite acting in good faith and with reasonable due diligence, the provider or facility makes an error or omission in a required GFE, provided that the provider or facility corrects the information as soon as practicable. If items or services are furnished before an error in the GFE is addressed, the provider or facility may be subject to PPDR if the actual billed charges are substantially in excess of the GFE to the extent that compliance with federal GFE requirements requires a provider or facility to obtain information from any other entity or individual. The provider or facility will not fail to comply with this section if it relied in good faith on the information from the other entity, unless the provider or facility knows or reasonably should have known that the information is incomplete or inaccurate. If the provider or facility learns that the information is incomplete or inaccurate, the provider or facility must provide corrected information to the uninsured or self-pay individual as soon as practical. If items or services are furnished before an error in a GFE is addressed, the provider or facility may be subject to PPDR if the actual billed charges are substantially in excess of the GFE. Here we show an example of how itemized lists of expected items and services could be displayed in a GFE. In addition, this second slide provides another example of how items or services could be displayed in a GFE. I will now hand the presentation over to my colleague, Jenny Frimpong, to discuss the patient-provider dispute resolution process.
Patient-provider dispute resolution process. Beginning January 1st, 2022, the patient-provider dispute resolution process will be available for uninsured or self-pay individuals who get a bill for an item or service that is substantially in excess of the expected charges on their good faith estimate. Under the PPDR process, an uninsured or self-pay individual can seek a determination from a selected dispute resolution entity for the amount the individual has to pay. This process can provide an uninsured or self-pay individual important consumer protections from billed charges that are substantially in excess of the expected charges in their good faith estimate. Items or services eligible for PPDR. The PPDR process can apply to any item or services furnished by a convening provider, convening facility, co-provider, or co-facility to an uninsured or self-pay individual where the total bill charges are substantially in excess of the total expected charges in the good faith estimate. HHS regulations establish that when the billed charges for any provider or facility are in excess of the good faith estimate for that provider or facility, by $400 or more, the item or service may be eligible for payment determination by an SDR entity through the PPDR process. As each good faith estimate could potentially contain expected charges for multiple providers and facilities, the substantially in excess determination is made separately for each specific provider or facility listed on the good faith estimate. Items or services eligible for PPDR continued. If a co-provider or co-facility that provided an estimate of the expected charge for an item or service in the good faith estimate is replaced by a different co-provider or co-facility less than 1 business day before that item or service is scheduled to be provided, an item or service billed by the replacement co-provider or co-facility is eligible for dispute resolution if the bill charge is $400 or more than the total expected charges included in the good faith estimate for the original co-provider or co-facility. If the replacement provider or facility provides the uninsured or self-pay individual with a new good faith estimate within the timeframes HHS has shared, then the determination of whether an item or service billed by the replacement co-provider or co-facility is eligible for dispute resolution is based on whether the total bill charges for the replacement co-provider or co-facility is $400 or more than the total expected charges included in the good faith estimate provided by the replacement co-provider or co-facility.
Knowledge check. Tanya is a 40-year-old female with a long history of right knee pain. She does not have any form of health insurance. Tanya schedules an appointment with her orthopedist to receive a cortisone injection in her knee. Upon scheduling the appointment, her orthopedist sends her a good faith estimate. Good faith estimate lists the total expected charges of $300 for the procedure. Tanya undergoes the injection and subsequently receives a bill from the orthopedist. The total bill charge is $850. Would Tanya be eligible to pursue the PPDR process? Knowledge check answer. Yes, Tanya would be eligible to pursue the PPDR process. Tanya is uninsured, and the total bill charge is considered substantially in excess of the good faith estimate, since the difference between the total expected and total bill charges is greater than or equivalent to $400. Under the NSA, in order to be eligible to pursue the PPDR process, an individual must be considered uninsured or self-pay. The total bill charges by the particular convening provider, convening facility, co-provider, or co-facility must be substantially in excess of the total expected charges for that specific provider or facility listed in the good faith estimate, and the date of the bill must be within 120 days.
Enforcement discretion in 2022 for expected charges for items and services from a co-provider or co-facility. For good faith estimates provided to uninsured or self-pay individuals on or after January 1st, 2022 through the end of the year, HHS will exercise our enforcement discretion in situations where the good faith estimate does not include expected charges for items and services from a co-provider or co-facility. If expected charges for a co-provider and co-facility do appear on the good faith estimate, those items or services will be eligible for the patient-provider dispute resolution process as normal. This particular application for PPDR eligibility would only apply in 2022. During the period of enforcement discretion, items or services to be provided by a co-provider or co-facility that appears on the good faith estimate that do not include an estimate of the expected charges or that appear as a range of expected charges would not be eligible for the PPDR process for the item or service provided by the co-provider or co-facility. Would a provider or facility be subject to requirements for the PPDR process, but not requirements for the good faith estimate? The good faith estimate requires requirements work together with the PPDR requirements to establish important consumer protections for uninsured or self-pay individuals who receive bill charges that are $400 or more than the good faith estimate they received prior to scheduling or upon request of items or services. As a result, the requirements for the PPDR process apply to all providers or facilities subject to the good faith estimate requirements. How is PPDR eligibility determined when there are different providers or facilities listed on the same good faith estimate? Eligibility for PPDR is determined separately for each unique provider or facility listed on the good faith estimate. For each provider or facility, the total expected charges for each item or service should be added up. This total amount is then compared with the total of all bill charges for that provider or facility, including bill charges for items and services that were furnished but not included in the good faith estimate to determine eligibility for PPDR. How is PPDR eligibility determined when there are different providers or facilities listed on the same good faith estimate? Continued. Example 1. In example 1, the good faith estimate contains two providers, provider A and provider B. The total expected charges for both providers A and B equal $2,625. However, for purposes of PPDR, the total of expected charges are separated by provider. In this case, the total expected charges for provider A are $2,125, and the total expected charges for provider B are $500. The bill charges for providers A and B are compared with their total expected charges to determine whether the bill charges are eligible for PPDR, as shown in example 2. How is PPDR eligibility determined when there are different providers or facilities listed on the same good faith estimate? Continued. Example 2. In example 2, even though the total of all bill charges for provider A, $2,400, is greater than the total of expected charges, $2,125, the difference between the bill charges and expected charges are less than $400. As a result, items provided by provider A are not eligible for PPDR. How is PPDR eligibility determined when there are different providers or facilities listed on the same good faith estimate? Continued. Example 3. In example 3, the total of all bill charges for provider A, $2,700, is greater than the total of expected charges, $2,125, and the difference between the bill charges and the expected charges are greater than $400. As a result, items provided by provider A are eligible for PPDR. How is PPDR eligibility determined when there are different providers or facilities listed on the same good faith estimate? Continued 4. Example 4. In example 4, the uninsured individual was billed by provider A for an item that did not appear on the good faith estimate. Item 4. Even though item 4 is not included in the total expected charges, as it did not appear on the good faith estimate, the bill charge for item 4 is included in the total bill charges. As the total bill charges exceed the total expected charges by $400 or more, items provided by provider A are eligible for PPDR. I will now pass you on to Joshua Annis to further discuss initiating a patient-provider dispute resolution.
Initiating the PPDR process. An uninsured or self-pay individual or their authorized representative can initiate the PPDR process by submitting an initiation notice to HHS through the online federal IDR portal, submitting an initiation notice electronically, or submitting through the mail if postmarked within 120 calendar days of receiving the initial bill containing charges for the item or service that is substantially in excess of the expected charges in the good faith estimate. HHS strongly recommends that the initiation notice be submitted through the federal IDR portal to help ensure the request can be processed quickly and securely. The initiation notice. When an uninsured or self-pay individual is billed for items or services where the total billed charges for a provider or facility are $400 or more above the total expected charges for the provider or facility in the good faith estimate, the uninsured or self-pay individual or their authorized representative may submit a notification, initiation notice, to HHS to initiate the PPDR process. The initiation notice must include all of the following: information sufficient to identify the items or services under dispute, including the date of service or date the item was provided, and a description of the item or service. A copy of the bill for the items and services under dispute. The copy can be a photocopy or an electronic image so long as that document is readable. Last 4 digits of the account number on the bill, and a copy of the good faith estimate for the items and services under dispute. Again, the copy can be a photocopy or an electronic image so long as the document is readable. The initiation notice continued. The contact information of the parties involved, including name, email address, phone number, and mailing address, the state where the items or services in dispute were furnished, and the uninsured or self-pay individual's contact information, including name, email address, phone number, mailing address, and communication preference, email, paper mail, or phone. What is the administrative fee and how does it work? HHS has established a $25 administrative fee to participate in the PPDR process in 2022. The fee amount is meant to ensure there is no barrier to an uninsured or self-pay individual's ability to access this process. The administrative fee is an amount paid by the individual to use the PPDR process to settle payment disputes with providers and facilities. HHS will assess the $25 administrative fee in 2022 on the non-prevailing party, providers, facilities, and uninsured or self-pay individuals to the PPDR process. The uninsured or self-pay individual will pay the administrative fee at the beginning of the process to the SDR entity. Providers and facilities are not required to pay the $25 administrative fee up front. If the SDR entity determines the payment amount to be lower than the bill charges, the SDR entity will apply an adjustment to the final payment determination amount to allow for the individual to recover the $25 paid. What is the administrative fee and how does it work? Continued. The amount of the administrative fee may change in future years, but any such change will be promulgated in advance by additional guidance. For more information on the PPDR administrative fee, see PPDR fee guidance. Prohibition on collections and retributive action. While the PPDR process is pending, the provider or facility must not move the bill for the disputed item or service into collection or threaten to do so. Or if the bill has already moved into collection, the provider or facility should cease collection efforts. The provider or facility must also suspend the accrual of any late fees on unpaid bill amounts until after the PPDR process has concluded. Finally, the provider or facility must not take or threaten to take any retributive action against an uninsured or self-pay individual for utilizing the PPDR process to seek resolution for a disputed item or service. The online federal IDR portal. When practicable, providers and facilities should use the online federal IDR portal to submit documentation for the PPDR process. The federal IDR portal is the same portal used for the federal IDR process, i.e. payer-provider and payer air ambulance provider processes. Providers and facilities may also receive notices from HHS and the SDR entity, submit additional supporting documents, and receive the SDR entity's determination via email. More information on the federal IDR portal can be found on the portal webpage. PPDR process following SDR receipt of initiation notice. The SDR entity will review the initiation notice submitted by the uninsured or self-pay individual to ensure that the items or services in dispute meet the eligibility criteria for the PPDR process and that the initiation notice contains all the required information. Once the SDR entity has determined that an item or service is eligible for dispute resolution and that the initiation notice contains all the required information, the SDR entity will notify the uninsured or self-pay individual and the provider or facility through the federal IDR portal or electronic or paper mail or phone that a PPDR initiation request has been received and is under review. PPDR process following SDR receipt of initiation notice continues. Additionally, the SDR entity will notify the provider or facility that they must provide certain information within 10 business days. HHS strongly recommends that this information be submitted using the federal IDR portal. This information must include all of the following: a copy of the good faith estimate provided to the uninsured or self-pay individual for the items or services under dispute. The copy can be a photocopy or an electronic image so long as the document is readable. A copy of the billed charges provided to the uninsured or self-pay individual for items or services under dispute. The copy can be a photocopy or an electronic image so long as the document is readable. And, if available, documentation providing evidence to demonstrate that the difference between the billed charges and the expected charges in the good faith estimate reflects the cost of a medically necessary item or service and is based on unforeseen circumstances that could not have reasonably been anticipated by the provider or facility when the good faith estimate was provided. PPDR process following SDR receipt of initiation notice continued. No later than 30 business days after receiving this information, the SDR entity must make a determination regarding the amount to be paid by the uninsured or self-pay individual. The SDR entity will also notify the uninsured or self-pay individual in cases where the initiation notice is determined to be incomplete or the item or service is determined ineligible for dispute resolution, in which case the uninsured or self-pay individual would be provided 21 calendar days to submit any missing information or provide supplemental information to demonstrate the item or service is eligible for the PPDR process. See the previous examples of calculating eligibility provided earlier in this presentation.
Knowledge check. Tom is a 30-year-old male with a history of a chronic cholecystitis, which has become progressively more symptomatic over time. He does not have health insurance of any kind. Tom is advised to schedule a laparoscopic cholecystectomy with the general surgeon. He schedules the surgery with the general surgeon. The provider sends Tom a good faith estimate for the surgery, which includes good faith estimates from the general surgeon and the anesthesiologist. The total expected charges for the general surgeon are $2,000. Tom undergoes the surgery. During the surgery, the surgeon determines that the surgery must be converted to an open cholecystectomy due to multiple adhesions to surrounding tissue. As a result, the surgery takes much longer than anticipated. Tom must stay inpatient for several days. Several weeks later, Tom receives a bill from the surgeon with total bill charges of $3,600. Tom submits an initiation notice to HHS to initiate the PPDR process, and the assigned SDR entity determines that the total bill charges are eligible for review under the PPDR process. Under the No Surprises Act, what information must the provider furnish to the SDR entity? Knowledge check answer. The provider must submit a copy of the good faith estimate and a copy of the bill charges. They must also submit documentation providing evidence to demonstrate that the difference between the billed charges and the expected charges in the good faith estimate reflects the cost of a medically necessary item or service and is based on unforeseen circumstances that could not have reasonably been anticipated by the provider or facility when the good faith estimate was provided.
How does the SDR entity make the determination? The SDR entity will review the billed charges to see if the items and services were included on the good faith estimate, as well as review all documentation timely submitted by the parties, including the uninsured or self-pay individual or their authorized representative and the provider or facility. The SDR entity will determine how much the uninsured or self-pay individual must pay based on documentation submitted by the provider or facility. Whether the provider or facility has provided credible information to demonstrate that the difference between the billed charge and the expected charge for the item or service in the good faith estimate reflects the cost of a medically necessary item or service and is based on unforeseen circumstances that could not have reasonably been anticipated by the provider or facility when the good faith estimate was provided. The SDR entity will make this assessment separately for each unique billed item or service. Examples of determining the payment amount. 1. For any item or service where the billed charge is equal to or less than the expected charge in the good faith estimate, the SDR entity would determine that the billed amount is not substantially in excess of the good faith estimate. In this case, is not eligible for the PPDR process. The SDR entity would inform the patient or their authorized representative that they are ineligible for this dispute resolution process. Example, billed charge $500, expected charge $975. The SDR entity would inform the patient or their authorized representative that this case is ineligible for a resolution via the PPDR process. Examples of determining the payment amount continued. 2. For a billed item or service that was included on the good faith estimate, if the billed charge for an item or service is substantially in excess of the expected charge in the good faith estimate, and the SDR entity determines the provider or facility has not provided credible information that the difference between the billed charge and the good faith estimate reflects the cost of a medically necessary item or service, and is based on unforeseen circumstances that could not have reasonably been anticipated by the provider or facility when the good faith estimate was provided, the SDR entity must determine the amount to be paid by the uninsured or self-pay individual for the item or service to be equal to the good faith estimate amount. Example, billed charge $875, the expected charge $450. The payment amount will be $450. Examples of determining the payment amount continued. 3. If the SDR entity determines that the provider or facility has provided credible information that the difference between the billed charge and the expected charge in the good faith estimate reflects the cost of a medically necessary item or service and is based on unforeseen circumstances, the SDR entity must select as the amount to be paid by the uninsured or self-pay individual the lesser of 1. The billed charge, or 2. The median payment amount paid by a plan or issuer for the same or similar service by a same or similar provider in the geographic area as defined in Section 149-140A7, where the services were provided. That is reflected in an independent database as defined in Section 149.140A3, using the methodology described in Section 149.140C3. Except that in cases where the amount determined by an independent database is determined to be less than the expected charge for the item or service listed on the good faith estimate. The amount to be paid will be equal to the expected charge for the item or service listed on the good faith estimate. When comparing the billed charge with the amounts contained in an independent database, the SDR entity should account for any discounts offered by the provider or facility. Examples of determining the payment amount continued. Example, billed charge $900, expected charge $450. If the SDR entity determines that the provider did provide credible information justifying the higher charge, the payment amount for the item will be the lower of $900 or the median payment amount described above, or if lower than the good faith estimate, the good faith estimate, $450. PPDR process, payment determination. Once the SDR entity determines whether the billed charges are justified, the SDR entity must determine the final payment amount for each item or service billed by the provider or facility. using the following rules. For any item or service that appears on the good faith estimate. What about items not originally on the good faith estimate? For billed items or services not listed on the good faith estimate, if the SDR entity determines the provider or facility did not provide credible information that demonstrates the difference between the billed charge for the new item or service and the good faith estimate reflects the cost of a medically necessary item or service and is based on unforeseen circumstances that could not have reasonably been anticipated by the provider or facility when the good faith estimate was provided, then the SDR entity must determine that the amount to be paid for the new item or service to be equal to $0. What about items not originally on the good faith estimate? Continued. If the SDR entity determines that a provider or facility has provided credible information that the billed charge for new items or services that did not appear on the good faith estimate does reflect the cost of a medically necessary item or service and is based on unforeseen circumstances that could not have been reasonably anticipated by the provider or facility when the good faith estimate was provided, then the SDR entity must determine the charge to be paid by the uninsured or self-pay individual for the new item or service as the lesser of 1, the billed charge, or 2, the median payment amount paid by a plan or issuer for the same or similar service by a same or similar provider in the geographic area as defined in section 149.140A7, where the services were provided, as reflected in an independent database as defined section 149.140A3, using the methodology described in section 149.140C3. When comparing the billed charge with the amounts contained in an independent database, the SDR entity should account for any discounts offered by the provider or facility. What about items not originally on the good faith estimate? Continued. After making a determination about each item and service subject to the PPDR, the SDR entity will add together the amounts to be paid for all items and services subject to the determination. In cases where the final amount determined by the SDR entity is lower than the billed charge, the SDR entity will reduce the final amount by the administrative fee amount paid by the individual. For any item or service that does not appear on the good faith estimate, for example, a new item or service, please see the table below. Can providers and facilities settle their payment dispute with uninsured or self-pay individuals during the PPDR process? Yes. HHS recognizes that the two parties to the PPDR process, the uninsured or self-pay individual and the provider or facility, may agree to resolve the dispute by settling on a payment amount. At any point after the PPDR process has been initiated, but before the date on which a determination is made by the SDR entity, the parties can settle the payment amount through either an offer of financial assistance or an offer to accept a lower amount or an agreement by the uninsured or self-paid individual to pay the billed charges in full. Can providers and facilities settle their payment dispute with uninsured or self-pay individuals during the PPDR process? Continue. In the event that the parties agree to settle on a payment amount, the provider or facility should notify the SDR entity through the federal IDR portal, electronically or in paper form, as soon as possible, no later than 3 business days after the date of the agreement. Once the SDR entity receives the notification of the settlement, the SDR entity must close the dispute resolution case as settled, and the agreed upon payment amount will apply.
Knowledge check. Maria is a 25-year-old female self-pay individual. She has an appointment with her gynecologist to discuss long-acting reversible contraceptives. Maria decides to schedule a procedure to have an intrauterine device placed. Upon scheduling the appointment, her gynecologist sends her a good faith estimate, which includes a total expected charge of $400. Maria undergoes the procedure. Several weeks later, she receives a bill for $850. Maria submits an initiation notice to HHS. However, before the SDR entity makes a determination, Maria instead agrees to pay the billed charges in full. Are parties allowed to settle a dispute outside of the PPDR process? Knowledge check answer. Yes. Parties are allowed to settle the payment amount after the PPDR process has been initiated, but before a determination is made. The parties can settle the payment amount through an offer of financial assistance, an offer to accept a lower amount, or an agreement by the uninsured or self-pay individual to pay the bill charges in full. If the parties agree to settle, the provider or facility must provide a settlement notification to the SDR entity no later than 3 business days after the date of the agreement.
Treatment of payments made prior to determination. Payment of the bill charges, or a portion of the bill charges, by the uninsured or self-pay individual, or by another party on behalf of the uninsured or self-pay individual, prior to a determination, does not demonstrate agreement by the individual to settle at that amount or any other amount. Deferral to state PPDR processes. If HHS determines that a state law provides a process to determine the amount to be paid by an uninsured or self-pay individual to a provider or facility, and that such process meets or exceeds minimum federal requirements, HHS shall defer to the state process and direct any PPDR requests received from uninsured or self-pay individuals in such state to the state process to adjudicate the dispute resolution initiation request. Extension of time periods for extenuating circumstances. Time periods specified throughout the PPDR process, other than the timing of all payments, including payment of the administrative fees, may be extended in extenuating circumstances at HHS's discretion if an extension is necessary to address delays due to matters beyond the control of the parties or for good cause, and the parties attest that prompt action will be taken to ensure that the determination under this section is made as soon as administratively practicable under the circumstances. Any party may request an extension by submitting a request for extension due to extenuating circumstances through the federal IDR portal or electronic or paper mail if the extension is necessary to address delays due to matters beyond the control of the party or for good cause. HHS model notices. HHS has developed a model notice that SDR entities may use to provide the determination notice to providers or facilities, and a model notice that providers or facilities may use to notify the SDR entity and HHS that all parties agree to settle on a payment amount. These model notices were published as part of CMS form number 10791 and are available for download. HHS model notices continue. HHS model notices continue too. Summary of the PPDR process. Areas of particular applicability to providers and facilities have been underlined for emphasis. Timeline, within 120 days, calendar dates. Process step, initiation notice and administrative fees. The uninsured or self-pay individual submits the initiation notice and other relevant information to the Secretary of the Department of Health and Human Services. The initiation notice must be sent within 120 calendar days from when the uninsured or self-pay individual received their initial bill for items and services from their provider or facility. HHS will choose and notify the selected dispute resolution entity. Once HHS has chosen the SDR entity, the uninsured or self-pay individual must pay an administrative fee to the SDR entity. Timeline, within 3 business days. Process step, SDR entity conflict of interest identification. Should a conflict of interest exist, HHS will select a new SDR entity to conduct the PPDR process. If no SDR entities are available to resolve the dispute, the initially selected SDR entity will be required to initiate their entity-level conflict of interest mitigation plan. which may include identifying a subcontractor whom they have verified does not have a conflict of interest, and submit notice to HHS related to the implementation of the mitigation plan no later than 3 business days following selection by HHS. HHS will then assign the case to the identified alternative SDR entity to conduct the PPDR process. Summary of the PPDR process continued. Timeline, within 21 calendar days. Process step, eligibility determination, and additional information. After the SDR entity receives information submitted by the uninsured or self-pay individual, it will notify them regarding whether or not they are eligible for PPDR, and if additional information is needed to determine eligibility, or if the patient can proceed to dispute resolution. If additional information is required, the patient has 21 calendar days to furnish it after being notified of the information deficiency. Process step 4, PPDR initiation. If the SDR entity determines that the item or service meets the eligibility criteria and the initiation notice contains the required information, the SDR entity will notify the uninsured or self-pay individual and the provider or facility that the item or service has been determined eligible for dispute resolution. Summary of the PPDR process continued. Timeline, within 3 business days. Process step, parties' conflict of interest identification. The uninsured or self-pay individual and provider or facility may attest to having a conflict of interest with the SDR entity. Should a conflict of interest exist, the SDR entity must notify HHS within 3 business days of receiving the attestation. HHS will select a different entity to conduct the PPDR process. Timeline, within 10 business days. Process step, provider or facility submits information. The provider or facility should submit any required information to the SDR entity within 10 business days of receipt of the selection notice. This information includes a copy of the good faith estimate provided to the uninsured or self-pay individual for the item or service under dispute, a copy of the billed charges provided to the uninsured or self-pay individual for the item or service under dispute, and, if available, documentation demonstrating that the difference between the billed charge and the expected charges in the good faith estimate reflects the cost of a medically necessary item or service and is based on unforeseen circumstances. Summary of the PPDR process continued. Timeline, within 3 business days. Process step, patient-provider negotiation. If the parties to a PPDR process agree on a payment amount through either an offer of financial assistance or an offer of a lower amount, or an agreement by the uninsured or self-pay individual to pay the billed charges in full, after the PPDR process has been initiated, but before the date on which a determination is made, the provider or facility will notify the SDR entity through the federal IDR portal, electronically or in paper form as soon as possible, but no later than 3 business days after the date of the agreement. The settlement notification must contain at a minimum the settlement amount, the date of such settlement, and documentation demonstrating that the provider or facility and uninsured or self-pay individual have agreed to the settlement. The settlement notice must also document that the provider or facility has applied a reduction to the uninsured or self-pay individual settlement amount equal to at least half the amount of the administrative fee paid. Summary of the PPDR process continues. Timeline, within 30 business days. Process step, payment determination for PPDR by the SDR entity. No later than 30 business days after receiving the required information from the provider or facility, the SDR entity must make a determination regarding the amount to be paid by the uninsured or self-pay individual, taking into account the requirements of the PPDR payment determination process. The SDR entity should inform both parties of this determination as soon as practicable after reaching a payment determination. The determination made by the SDR entity will be binding upon the parties involved, in the absence of fraud or evidence of misrepresentation of fact presented to the selected SDR entity regarding the claim, except that the provider or facility may provide financial assistance or agree to an offer for a lower payment amount within the SDR entity's determination. The uninsured or self-pay individual may agree to pay the billed charges in full, or the uninsured or self-pay individual and the provider or facility may agree to a different payment amount. Time period extensions. Process step. Extenuating circumstances. The parties may request extensions to most of the time periods above in cases of extenuating circumstances.
Now I'd like to provide a recap of today's main takeaways. The No Surprises Act protects uninsured or self-pay individuals from unexpectedly high medical bills in two ways. If an individual does not have certain types of health insurance or does not plan to use that insurance to pay for healthcare items or services, they are eligible to receive a good faith estimate of what they may be charged before they receive the item or service. When the billed charges for any provider or facility are in excess of the good faith estimate for that provider or facility by $400 or more, the item or service may be eligible for payment determination by an SDR entity through the PPDR process. A convening provider must provide a good faith estimate to the uninsured individual, including any item or service that is reasonably expected to be provided in conjunction with a scheduled or requested item or service by another provider or facility. A co-provider or co-facility is a provider or facility other than a convening provider or a convening facility that furnishes items or services that are customarily provided in conjunction with a primary item or service. Providers and facilities' main responsibilities in the PPDR process include: the provider or facility should submit any required information to the SDR entity within 10 business days of receipt of the selection notice. While the PPDR process is pending, the provider or facility must not move the bill for the disputed item or service into collection or threaten to do so. Or if the bill has already moved into collection, the provider or facility should cease collection efforts. The provider or facility must also suspend the accrual of any late fees on unpaid bill amounts until after the PPDR process has concluded. In the event that the parties agree to settle on a payment amount, the provider or facility should notify the SDR entity through the federal IDR portal, electronically, or in paper form as soon as possible, but no later than 3 business days after the date of the agreement. The determination made by the SDR entity will be binding upon the parties involved. This slide provides additional resources, including links to the rule and published guidance, a sample disclaimer and model notice, a link to the No Surprises Act website, and contact information for the No Surprises Help Desk, which is staffed from 8 a.m. to 8 p.m. Eastern Time, 7 days a week. Providers who have questions about the No Surprises Act provisions may email provider_enforcement@cms.hhs.gov. The rest of the slide deck is a glossary of terms used in the presentation. Please review at your leisure, and thank you for viewing this presentation.